Good morning, everyone, and welcome to our Arundel County weekly media call. We're going to get started in just a second. So our two speakers today are County Executive Stuart Pittman and then Dr. Nilesh Kalyanaraman, the health officer. After our speakers, we will open it up for media questions. So with that, I'll turn it over to County Executive Stuart Pittman.
All right. Well, thank you for joining us. So starting out with COVID, case rates relatively steady, slight drop in our positivity rate, which is great. But we are higher than we'd like to be. I think we're part of the Baltimore region. You'll note that the counties, Baltimore City and the counties around it have the highest rates in the state, due, we're assuming, to the prevalence of the UK variant in that region. So our numbers reflect that. The modeling does suggest that we are at the peak. So we hope that's accurate and that we will soon be dropping due to the fact that half of our adult population is vaccinated with the first dose. Spring is here, warmer weather. And if we can continue to mask and social distance as well as get vaccinated, we think that the numbers will start dropping soon. Our hospitals do not project an increase at this point, and we hope that they will see a decrease very soon. So good news on the horizon, we believe. Our allocations from the state to our Department of Health have dropped. They dropped last week from about 6,000 to 3,800, and that's holding steady right now. We did get an additional 500 doses this week for our community vaccination clinics, which is helping. And then, of course, we have now the state vaccination clinic at Navy Stadium, a real team effort. Those of you who joined our tour last week will have noticed that it's quite a production, going very well. We're told that starting tomorrow, there will be some walk-up appointments, or not appointments, but people can walk up from 9 to 11 a.m. That is subject to change, but we're still encouraging people to get appointments, and they can get appointments for that site at covid.maryland.gov. But of course, all of our county sites are operating, and those appointments can be made directly at aacounty.org/COVIDvax. And we are continuing, of course, to do the work at our community vaccination clinics. And because we're at that 50% place, it's getting harder and harder to get people who weren't as eager to begin with to get vaccinated. So we're doing a lot of community outreach. And I'd actually like to show you a brief video that's an example of that work that we're trying to push out, and we hope that you will help us push out.
The vaccine is a miracle. The time it's taken to get it through a process that normally takes way too long, it says a whole lot about our prayers, that our prayers are being answered. We are our brother's keeper. I'm not just your neighbor. I'm someone that looks out for you like you look out for me. When you protect yourself by getting the vaccine, you're also protecting others who are part of your life. Listen, it's worth a shot.
I love that. The vaccine is a miracle. You have that direct from Bishop Craig Coates. Also want to remind people that you can call the COVID warm line as well if the internet is not your thing, for appointments and all things COVID at 410-222-7265. Dr. Kalyanaraman will have more on COVID work. But I just want to mention that last night the county council met. It was a late one, well past the midnight hour. And I want to thank them for the hard work that they're doing on the general development plan, Plan 2040. Whenever you talk about land use, it gets somewhat contentious, and I just appreciate the fact that they're getting through this. And we will have a new general development plan soon, I hope, that is really shifting our county to a smart growth, pro-environment, and pro-people agenda. The other bill last night that was just introduced but not yet discussed, Bill 3121, I'm particularly proud of. It's to establish our Resilience Authority, which will be the first in the state of Maryland to implement the resilience plan that we're working with our partners at the University of Maryland for Anne Arundel County. And with our 530 miles of coast, we absolutely have to be a leader in addressing planning and response to sea level rise and storm surges. So look forward to passing that and getting it started in Anne Arundel County. Great response to Secretary of State Blinken's comments on climate change yesterday at the Chesapeake Bay Foundation. And then I want to thank Secretary Grumbles, for Secretary of Maryland Department of the Environment, and his team, not just for the action that they took yesterday at Ecology Services for repeated violations there on environmental regulations, but for also caring enough to come out into our community and tour the site, look at the impact of those violations, the destruction of the yellow perch eggs that our Magathie River Association volunteers have so carefully protected at the right at the outfall of Lake Waterford, one of our beautiful parks, was a really vivid demonstration of why we must regulate stormwater and sediment runoff in our county. And then finally, I just want to mention our next 2 Tuesday nights with the county executive, which can be seen on Facebook at 6 p.m. Tonight is a very large group. We'll be gathering to talk about the Bay Crossing study and next steps with that. And I'm joined by the Broadneck Council of Communities, as well as the Queen Anne Conservation Association, to discuss what we believe are flaws in the work that's been done, and opposition, in my case, certainly, and to many of our residents, to building a third span at the current site of the Bay Bridge. And then 2 weeks later, May 4th, we will have our police department doing a presentation on our new body-worn camera program, so that residents can learn what it means, how it's going to work, and also comment on some of the policy that we've introduced in how these are going to operate. So look forward to that as well. And I will turn it over to you, Dr. Kalyan Raman.
Thank you, County Executive. Start with the data. We're seeing that our case rate has been flat for a number of weeks now, almost 3 weeks now, right around 22. We are encouragingly seeing our percent positivity go down a little bit. It was 7.9% last week. It was 7.1%. Sorry, 7.9% 2 weeks ago, 7.1% last week. Our hospital occupancy is in the 70s at this point. Last couple of days showing an encouraging sign of starting to tick down, and as the county executive noted, our projections suggest that we're at or near the peak of hospital occupancy, and so really critical to see what happens over the next week, and hopefully that decrease holds and continues, frankly. In terms of vaccinations, we are now over the 50% mark for people over the age of 18. The number of people who've gotten at least one dose is now about 51%. So that's great, but we want to get that second half. And so we really do encourage people to take advantage of all the different ways there are to get vaccinated now. There are a lot more sites, of course, with the Navy Stadium site, but also with our community vaccination sites and our 5 fixed sites throughout the county, or frankly, any of the other sites that we got throughout the state. It's really important, and it's actually going to be the thing that's going to help us get as close back to normal as we can while we're waiting for childhood vaccines. Is the more people who get vaccinated, the harder it is for the vaccine to spread, and the easier it is to engage in activities. So we really do encourage you to get that vaccine. I appreciate Bishop Coates calling it a miracle. We have truly seen something remarkable come from the science on this in terms of getting a vaccine in a year. And we're just going to keep pushing, keep engaging, and try to get folks vaccinated. The warm line number is 410-222-7256. So if anybody does need help in getting an appointment or any other COVID questions, that's the number that they can call. And with that, I will turn it back over to you, Chris.
Great, thanks, Doc. Short and sweet today, and now it's time for your favorite part, where you get to ask questions. So if you'd like to ask a question of either Dr. Nilesh or the county exec, please put your name and your affiliation in the chat, or use the raise your hand function in Zoom. So we'll get it kicked off like we usually do with Danielle Ohl from the Capitol.
Hi, good morning. Mr. County Executive, can you remind us why you oppose a third span of the Bay Bridge at the current site?
Yes, I think we've described it as yesterday's bridge tomorrow. It's somewhere in the $5 to $10 billion range in terms of price, and it's based on a demonstration of need, and that need is based on projections of increased traffic on the bridge, particularly weekday traffic. And if we're going to have weekday traffic growth, that means that there are going to be more people living on the other side, which means sprawl development on the Eastern Shore. And I know that a lot of folks over there do not want the farmland to be turned into suburbia, or it's going to be just more people commuting. And so we've seen a reduction in commuters due to COVID and people working from home. I believe that probably the next administration at the state level is going to get back to the smart growth principles and transit-oriented development and transit investments rather than highways and bridges to new areas. So, and they have not really looked at the corridor. They've only looked at bridge traffic. And so if they put another span there and nowhere else, it's not going to address the traffic problems that we have on Route 50 and in all of the communities that surround Route 50 when people can't get through on Route 50. So it's very short-sighted in my view, and it doesn't consider a lot of the work that's being done to reduce traffic in other ways.
Thank you. And a quick one for Dr. Kalyana Raman. Do you have any concern that the county vaccinations are going to plateau before we reach that 75%? That's kind of the goal for herd immunity.
So yeah, we're talking about our goal is really to try to get to that 80% mark. 70-80% is where we think that population immunity is going to happen. We're starting to see some plateauing, but that's why we're really pushing. Are we concerned? I'll be concerned if we don't get there, but it's really critical for folks to understand that this is our path.
Thank you.
Okay, thanks. So next we've got Kate Amara from WBAL. Go ahead, Kate.
Hey, good morning. I have one question for the county exec and one question for Dr. K. So for County Executive Pittman, you mentioned the drop in vaccine supply from the state this week. How much of that is attributed to the Johnson & Johnson, not getting the Johnson & Johnson? And can you explain how at your county level, how do the current problems with Johnson & Johnson impact your overall vaccine campaign and your timeline for achieving herd immunity, and how that may impact residents and plans they have going forward?
Well, I suspect that Dr. Kalyana will have a better answer than I, but yes, definitely. It was last week when they first lowered that number, not this week, but absolutely. First, as a result of the production problems with Johnson & Johnson and withholding, not being able to deliver on the numbers that they expected. And then second, on the pause in Johnson & Johnson, and he can talk more specifically to what he thinks that's going to mean in terms of our progress.
Yeah, the cut in doses is entirely due to that Johnson & Johnson, largely really the manufacturing issue that came up a few weeks ago. In terms of our progress, it will slow us down a little bit. It's not gonna derail our progress, but it just means it's gonna take maybe a few weeks longer to get to the population immunity target that we have.
And if I just may follow up on that, Dr. K, and then ask you a separate question. So what is I know that nobody wants to put an exact date on it, but what is the current, you said a few weeks later for the target? What's the general timeline of that target? And then in a separate question, can you give us an update on how you've been monitoring residents or patients who got the Johnson & Johnson through any of your clinics, and have any of these cases of rare blood clots arisen so far in that monitoring? Thanks.
So yeah, our goal was that by the end of May, that if if supplies held, we get close to 80% of folks getting at least one dose. We'll see how that goes in terms of is there enough Moderna or Pfizer increase in production that might help us with catch up some lost ground. And the other piece, of course, is demand and making sure that people still want to get it out, get it and come out for it. So we'll have to see how that plays out. So when I say a week or two, we're really talking about the end of May was really our target. The second question about the Johnson & Johnson vaccine, to our knowledge, none of these clotting events have happened to a Maryland resident. In terms of monitoring, we do ask people to do a couple of things. One is to register for the VSafe, which is the CDC program to collect any side effects from any of the 3 vaccines. And it's done through a mobile app. And the other, of course, is that there's the long-standing vaccine adverse event reporting system, VAERS, which people can report into, but is particularly used by healthcare professionals and us as well to report any significant side effects that occur. So we are participating in that, of course, and as I said, people can submit their own information through that VSafe app.
And I'm sorry, just to make sure I got this correctly. So your original target date was end of May, and now because of this, it might get pushed several weeks past that to like mid-June. I understood that correctly?
Yeah, it might be. I still think that we'll see how the next month and a half unfolds, but we're still hoping that by end of May we can really hit that target of getting 80% of folks.
Okay, thank you.
Great, and now we've got Rita from WNAV Radio wants to ask a question to Bob Mosier. So Bob, if you can show yourself, there you go. Go ahead, Rita.
Hi, Bob. I was hopeful you can give me a status report as to the start of spring sports, especially because of the cancellation of some of the premier high school football seasons that just went kaput.
Sure. Good morning. So spring sports are proceeding on schedule. Practices started on Saturday and are continuing. The competitive season begins May 7th. We're committed to providing as many opportunities for our student athletes and our students as we can for as long as we can. And to be clear on the shutdown of shutdown of the fall sports piece, that was merely a function of timing in that the number of close contacts on those teams happened in the last 2 weeks of the season. So had that happened earlier in the season, right, a team could have resumed playing. So I just want to make that clear.
Also, I checked out the COVID-19 dashboard. Can you summarize what I'm seeing there?
Sure. You're seeing the total number of cases of both students and employees who have been in our buildings. And then the total number of active cases, which are cases within the last 14 days for which someone is still serving, still taking part in an isolation or a quarantine period.
So I noticed that there's like 50 students and 11 staff. Explain
Those are active cases, right?
Those are active cases.
Correct.
And is there any concern again about the spread or?
Well, we're not seeing spread in schools. You know, what we're seeing is these are people who very likely would have COVID anyway if our schools were not open. They're a reflection of the case rate and the communities in which the schools are located. We typically have a single case in a school without any spread. We have had to shut down 1 or 2 classrooms. I forget the exact number, but it's not very many at all. And so, you know, our teachers and our administrators are taking the precautions that they're supposed to be taking. We continue to talk to Dr. Kalyana and his team on a regular basis about the status of our schools, and we're comfortable with where we are.
Thank you. Dr. K, do you think you have anything you want to add to the comments?
I think Bob covered it.
All right. Thank you very much.
Great. Well, I know Dr. Kalyana wanted to clarify one thing to Kate's question. So go ahead, Doc.
Yeah, Kate, I wanted to clarify that we're talking about 80% of eligible adults over the age of 18. So that excludes all the kids under 18 who really don't have access to the vaccine yet. We'll put the 16 and 17-year-olds aside for a second. And so I just wanted to clarify that even if we get 80% of adults by then, that still doesn't bring us as a population to population immunity yet, because that's only about 3/4 of the total population, if that makes sense.
No, that does make sense, because different jurisdictions, some are talking about 80% of the total population, and others are talking about the eligible population. So should I, in all of, when you talk about, at least at this point, percentage-wise, should we, are you referring to eligible?
I will.
It makes a big difference. It makes a big difference.
So the key, I think the key distinguishing factor here is, from an operational standpoint, all we can do is try to vaccinate as many people as who are eligible right now. So when we say that our goal is to get to 80% of the eligible population, that is still true. From a global sense, we don't really achieve population immunity until we get to 80% of everybody. So I think it's just important to keep clear which one we're talking about. And I'm talking about our vaccination goal, but that doesn't bring us to population immunity yet until we get all the kids eligible as well.
Thank you. Thanks for clarifying that.
And now we have John Frenay from Ione Annapolis has another question.
Hey, Bob, have you guys had any discussions about next fall? I understand that Montgomery County just announced this morning that they are going to be offering a fully virtual option for next fall.
Yeah, so Dr. Alata has been really clear that our intent is to go 5 days a week in person for students next fall. We are discussing the possibilities of virtual options at this time, though.
Okay, so stay tuned.
Yes.
Thanks.
Okay, so last call for questions. John's was the last one we had in the chat. All right, well, thank you, everyone. Enjoy the rest of your Tuesday. It's beautiful outside.